Good afternoon, ladies and gentlemen. Welcome to this new episode of Medcast, your gateway to the latest medical updates by receiving the medical professionals and to reply to the rumors we have in the society. We are honored today to have again Dr. Rawan AlKhuwaitem, who is specialized in pediatric dentistry in addition to the special needs dentistry. Welcome, Dr. Rawan.
Thank you.
We are so pleased to have you for the second time.
My pleasure.
Hopefully, this episode also goes useful as the previous one. So,
Inshallah.
we have a new subject related to the special needs dentistry.
Okay.
Now, first of all, before getting into the special needs industry, we need to know how the first visit of the dentist by the child is getting an impact on him.
Well, the first visit will shape future visit for the child.
Yes.
If the first visit was short, less stressful, doesn't contain anything that could cause pain to the child, then for sure the experience for the future visit will be much easier for the
Yes.
child and for the dentist. That's why I always recommend visiting at the dentist before even having a dental pain, just for checkup, chit-chatting, building a rapport between you and the dentist will shape the future of this child, because you will be surprised about the prevalence of elderly people and adult people who have dental phobia and dental anxiety because of a bad history when they were children.
That's me.
Really?
Yes, I have to say it.
Sorry. So our role as a pediatric dentist is to change this. We are here to shape these little children personalities for the future and their experiences with the dentist. So if the child come to the dentist, first dental visit will be easy, counting teeth, checking if there is any dental problems, educating the child how to brush their teeth, and if there is anything to do is to plan it for future visit. I always make it short, less stressful. And that depends whether the child is a healthy child or a child with a special healthcare needs.
Good.
Okay?
Yeah, that's very fruitful actually. Now, if the parents having or the children is having an emergency case of something related to their teeth, how would you give them an advice to deal with it at home and then until they bring them to the dentist?
Depends what sort of emergency. For example, now if we are talking about a knocked out tooth and it's a permanent tooth, we always educate the schools and the healthcare givers that if it's a permanent tooth, not a baby tooth, always make sure if it's fall out to make to store it in a milk or water and to go directly to the dentist ASAP. However, if they have, for example, a chipped out part of the tooth, fractured, chipped, to look first for the chipped fragment to make sure that the child didn't swallow it or inhale it, and to store it somewhere as well in milk or water, and to come to the dentist ASAP as well. If the child, for example, has a dental pain that is like causing swelling, especially if it's an extraoral swelling or facial cellulitis, visit a dentist. Go to the emergency if this swelling is causing disruption in terms of breathing. So this is an emergency situation. They need to be admitted to the hospital and to take antibiotic intravenously. If the swelling is just concise, just related to the, for example, upper or lower jaw, it's not causing any problems with the eyes, then come to us. We will assess. We will check if there is any systematic involvement. If the antibiotic is needed, we will give, because there is a misconception that if the child has a swelling, they need to take antibiotic first and then to get the treatment.
Yes.
This is before. Now, all the guidelines recommend if there is no systematic involvement, we can treat the child. If it's for example, extraction, we can remove the tooth. If the dentist thinks that antibiotic should be prescribed, we will prescribe.
Otherwise, you will not give it to the patient
No,
like without
because
any
we're removing
clear
the source
reason.
of infection.
Yes,
Yeah.
that's great. Now,
And you're a pharmacist, you know we
yes.
want to avoid bacteria resistance.
Yes, definitely,
Okay.
because we are having a very growing problem now in the society
Yeah.
because of the misuse of the antibiotics. So we don't need to get into a long discussion
everything.
regarding the use of antibiotics. Now, the question is, how would you comment about the parents that use the normal instruments in the home to extract the tooth if it's wiggling?
Well, as Dr. Rawan, I always recommend that the child do the removal of the baby tooth if it's really wobbly and there is no roots, and he's having, for example, the shark teeth, when we have the adult teeth behind the baby teeth and the baby teeth is really moving. It's just to encourage the child biting a piece of apple, a carrot, cucumber, because the more they bite, they will, or for example, a really cold ice cream,
Yeah.
because it will help to ease the pain. So they can bite really hard, the tooth will come off. However, if the tooth contain a crown, for example, and they're worried that it's really loose, however, it's still attaching to the gum, and they're worried, they don't want, because I've heard some stories that they put some ropes or anything just to pull
To
out
pull
the
it
tooth.
out, yeah.
It's unhealthy
I
because
once
I'm not sure which material, which instrument they're using.
sometimes they use
Sometimes
the
I just put a gel
yeah.
and I'll just use the child finger and help him and direct him with a mirror, and he will feel very proud that he did it himself
Yes.
with a little like pressure from me and a little help.
So you know, with the rope thing, sometimes they try to put it on a rope and then put it the other
On the
side, put it on
door,
a door, and then
and
they
then
pull it out in a
why would
surprising
they
way.
go through all of this?
Well, now you know, comparing to the past, now we have the dentist everywhere, so
Yes,
they are more
we have
easy
the direct
accessible.
access, to be
Yes.
honest. Yeah.
Now, this goes us for another subject, which is related to the special needs industry. Now, what are the common problems you have, or common, let's say, diseases you have seen in the special needs children?
Children with the special healthcare needs are more prone to dental cavities and, for example, dry mouth as well, because it depends on which type of special healthcare needs they have, because it's a wide umbrella. It comes under it. It comes the people with medical issues, medically compromised patient who have, for example, cardiac problems or diabetes or hypertension or problems in the endocrine. So these people are considered as a special healthcare needs children. We have people with motor issues, with development issues. We have people with behavior problems, like the people with autism or ADHD spectrum. So it depends which category are they under, and most of them. Who are the ones who are giving the care for them?
Yes.
The healthcare givers are the care providers are their
The
parents.
parents, yes.
So they have a special role in terms of looking after these children teeth. So we educate them, we help them. Sometimes it's very difficult because most of these will have multiple appointments in terms of the medical fields,
Yes.
and when it comes to dentistry, it's the least thing they think about, and I don't blame them. I'm just there to help them. These patients under this category, I advise the parents to come to visit me every 1 month and a half or every 6 weeks, because I know the brushing is very difficult. With the help of me, it will be easier to detect any early cavity that they're gonna have, any problems, so I can put an input. If the child have multiple cavities, because these children mostly will have either medication that contain sugar, and we don't really blame them. This is for their general health. Or they have medication that could cause a dry mouth, xerostomia, which could lead then to infections and cavities.
Yes.
So, if behavior is an issue and there is complexity of treatment and multiple restorations, then most of these category patients will go under general anesthesia, where we put them fully asleep. If it is advisable, because we liaise with their physicians, are they allowed to go under general anesthesia? We give our input. They have multiple cavities, they have multiple problems, and in one session we can manage to finish all of this. So we'll put them under sleep and then we'll treat everything. If they are cooperative and they have only few things, and putting them on the dental chair for treatment won't cause any harm and discomfort, then I can treat them on the dental chair. So it depends.
Okay, that's very great.
It's
Now,
not a generalized thing.
what I need to know actually is your story on the first case of a special need child you had. How did you deal with it?
Well, if I want to give a story about a child in the private clinic, the first encounter was a child who's under autism spectrum. He had previous experience with a previous dentist, which was unpleasant, to be honest. For me, it was a big challenge because he was resisting to get inside the clinic. And the mother came to me directly inside my clinic, and she wanted to speak to me before even getting the child out of of the car. So I totally understood her situation. Then I told her, we don't need to see him in my clinic. We can meet on the
In the car.
not in the car. He found a toy shop. Then I told her I can go down to the toy shop, and then this will be the first encounter for me and him meeting together. And imagine it took me 3 visits to desensitize him because he needs, as a child with autism, he need to be familiarized with you.
Yeah.
And then he need to be desensitized to come multiple times before even getting on your dental chair. So when I gain his trust, I'm now able to treat him on the dental chair. I didn't need even to put him asleep to do the treatments, but that caused me multiple visits. But at the end, I managed.
Okay.
And
How?
now it's been 3 years since I've been treating this child. And whenever they come to me, the mom will always remind me of this situation because she's proud that from a child who cannot even come inside, and we used to meet downstairs in the toy shop,
To someone now
to
to.
someone is fully cooperative.
Yeah.
And this is the rewarding part of my job.
Well, that sounds very great because you try to change someone who is like having some
Yeah.
sorts of difficulties.
Because I knew his needs.
Yeah.
That's why you need to know your dentist before going.
Now let's.
You need to go to a specialist who knows special care dentistry and who's a pediatric dentist.
And I think you need like enough knowledge in psychology as well on how to deal with different kinds of people. Now let's have an
In
advice
everything.
in everything. Yeah, as you said, let's have an advice that goes for the dentist or for the medical professionals in general. So how would you give a small piece of advice as we are getting to the end of our segments to the professionals that try to deal or accommodate with the patients with the special needs?
I always recommend to my colleague, especially on the medical field, if they have a child who's special care needs patient, and they think that they have, because they always check their mouth, they check everything overall. If they think that the child needs to see a dentist, to direct the mom to the healthcare providers, the pediatric dentists. We are everywhere.
Yeah.
In Kuwait, alhamdulillah, we have multiple specialized dental center where we all see special needs patients, and even the country is providing a free service for them, even to put to sleep under general anesthesia. So if you think the child is not seeing a dentist, and maybe sometimes the parent thinks it's not important, it's your role as a medical healthcare provider is to direct them and to advise them, because the overall health of the body depends on the oral health.
Sure.
It's your first part and inside your overall body, because sometimes I will be the first person who will detect a problem, a medical problem, unfortunately, before anyone else,
Yes,
because of the oral manifestations.
definitely. And as well as dealing with that kind of patients with peace of mind, rather than like trying to struggle to deal with them or
Yeah, exactly.
deal with them with anger or something.
No.
I really found this speech is very interesting, especially
you.
with the parts of the stories, because I like to hear stories from the clinics. But unfortunately, we have reached to the end of our segments. Hopefully, we can see you again here.
Inshallah.
Inshallah. Thank you very much for your
You're
existence.
welcome.
Thank you. Our dear viewers, we have reached to the end of our segments. Hopefully, we can see you in another segment with a new healthcare professional. Until that time, see you later.